Hello and welcome to the Carers of Dundee Virtual Hub. My name's Sarah Both and I'm Team Manager at the Carers Centre. Today we have a special hub which is not just for those of us in Dundee but is for Tayside wide. So I'd like to welcome viewers from Perth and Angus areas who might not have joined us before. First of all, I'd like to introduce Diane Caldwell, who is the Clinical Care Group Manager for the CAMHS service. Hi, Diane.
Hi there, Sarah.
Good
Thank you
to
for
see
inviting
you.
us along.
Thank you. And I'm also joined by Keren, who is the Mental Health Education Officer at CAMHS.
Hi, Sarah. Thanks for having me there. Hello.
Good to see you. Just before we get started, this hub is focusing on a new initiative that CAMHS have developed, which is, I'll let Diane introduce. She's prepared a short video, which is a new resource online portal for people with neurodevelopmental conditions. So we'll pass on to the video that Diane has prepared.
Welcome everyone to the consultation event of our new Neurodevelopmental Portal. I am Diane Caldwell, the Clinical Care Group Manager for CAMHS Tayside. Today, I am pleased to launch the opening of consultation for an exciting new project to develop an online service in partnership with CAMHS, our 3 local authorities and third sector partners. There has been an unprecedented demand for neurodevelopmental services, not just in Tayside, but across Scotland as a whole. This has led to unacceptable waiting times for families who need to engage with the CAMHS service. COVID-19 has of course had an impact on our waiting times, but it is fair to say that an increase in demand for the service has added to the problem of long waits. We know that these unacceptable waiting times for treatment will have a further impact on the mental health of our children and families. In response to this current situation, we realised that we had an opportunity to alleviate some of these issues families are facing and dealing with on a daily basis. So providing immediate information and support for families in a way that is meaningful and easily accessible seemed appropriate. To this end, we would like to invite as many children, young people and families as possible to be part of this exciting new development. What we would like to know: what are your experiences of a family waiting an extended time for neurodevelopmental services? What would help you as a family to cope with these issues on a daily basis? And what prevents our children and young people thriving in our communities because of lengthy waits? Our CAMHS clinicians will work alongside children and young people to co-produce tools and information that may assist families while they wait for services. It is hoped that by getting as much information from yourselves as possible, we can produce an online service that will really make a difference to the lives of our children and young people. Our CAMHS online survey will be launched on our Facebook page on the 3rd of November. You will also be able to join focus groups that will take place within our key partnership organisations. I would like to urge families to please engage in one of these processes. We want to make a difference. CAMHS NHS Tayside are working with partners to improve our neurodevelopmental pathways. We want to ensure families get the right help they need at the right time, by the right person and in the right place, and of course in a timely fashion. We have a very comprehensive programme of improvements and we have commenced the implementation of many of these actions. It is hoped the portal will go some way to improving outcomes for children, young people and their families with their daily lives while waiting on new developmental services. I would like to take this opportunity to thank everyone who engages in our consultation process and hope this new digital service will be of benefit to all our families. Thank you.
Thank you very much, Diane. This is a really exciting initiative and it's great to have you and Keren here to answer some questions. I'd just like to say to people watching this broadcast, just as it comes up on the screen, if you've got any questions today, if you put them in the comments section below, or if you would prefer to direct message us, then the appropriate person will get back to you directly. So, sounds like there's lots of opportunities for families to get involved, and you mentioned you've got a lot of partners involved. Obviously the Carers Centre are one of them. Keren, could you tell us a bit more about some of the other partners who are involved in this?
Yeah, there are 13 services and partners that have become involved to help us build this neurodevelopmental portal. So Perth Autism Support, Dundee and Angus ADHD Support Group, Perth ADHD Support Group. We have Parent to Parent, we have Parents Supporting Parents, we have Nurture Steps, we have Angus Carer Centre, we have a school nursing team supporting us, we have the Dundee Educational Psychology Service supporting us. We have Bernardo supporting us. There are a whole New Solutions. There is a whole host of key partner organisations who are daily working with parents waiting for neurodevelopmental assessment, who are kind of really aware of the challenge that poses. So they've really kindly come together, given us their time, and are working together to produce this.
That's fab. So if somebody watching this is already in contact with, say, Dundee Carer Centre, Angus Carer Centre, one of these other organisations, is the best way to get involved in this process just to speak to the worker from that agency and get involved that way? Is that what you would suggest?
Yeah, if you're already involved in one of these partner organisations, all of these organisations have agreed to host focus groups for us to kind of really talk to families about their experience and to kind of gather information about what would be helpful right now for families. And that will be advertised through their own social media channels. Alternatively, we will be posting surveys, Mentimeters, all sorts of calls to action on our social media page at NHS Tayside CAMHS, so people can access it there too.
That's brilliant. So just to check, that means that even if families aren't currently engaged with CAMHS or not engaged with one of those agencies, there's still ways that they can get involved in this process.
Absolutely. This portal is for all families where there's even a concern that there might be something for their child, or there are difficulties that their child's experiencing that they want to be able to support their child with. It's for all families. You don't need to be involved in CAMHS. You don't need to be on our waiting list. It's a useful resource so that young people and children and families can get support really, really quickly.
Yeah.
That's fab. Thank you. So what kind of difference do you think getting involved would make for families? You've already spoken about getting those resources. Will they get the opportunity? Is it just consultation, or is there a longer term bit of work? Can they work alongside people from CAMHS developing these new resources?
Yeah, so first and foremost, it's really important that we understand the needs of families so that we can make sure that portal meets that need. So we need to hear about experiences. We need to hear about what would be helpful right now. There are, certainly into the CAMHS service, there's routine calls that are made to duty workers for support. So we know some of the issues. We want to make sure that we get it absolutely clear. And then the really important bit about this portal is that it will be co-created with families. So you can become involved just by filling in a survey or taking part in a focus group. But if you really want to get involved with us as a service, work with clinicians to develop the content that will go onto the portal, there's a review everything that's being done, work with the graphic designers to make sure that it works for families, that it's accessible and clear, then absolutely there's opportunity to get involved in all of that. And we really want to have parents at the table with us as a kind of key partner group to make sure that we're getting this right.
That sounds really great. And will there be opportunities for siblings as well to get young people's views as part of this process?
Yeah, absolutely. We need as many views as possible so that we can make sure that this resource is helpful for families. And we're going to be looking into kind of also creative ways of working with children and young people too. So this is just the beginning.
That's really great. One concern people might have, Diane, is that if there's a lot of effort going into developing online resources, would that mean that some people might not be able to get a face-to-face service? Or could you maybe expand on that?
Absolutely not. We want to provide a menu of opportunities for engagement, and online is one. We have had feedback from families and children and young people to say they don't like the digital face-to-face, but they would prefer phone calls, or they would like face-to-face within the service. There is some assessments we have to do face-to-face within the service, and that'll continue. We're here to provide a service as slick as, if you like, as we can, and then what's suitable. Perth and Kinross, NHS Tayside is a large area, and travelling for some people is really quite a problem. So this opportunity we've had to use Near Me or digital platforms has been really, really welcomed by a lot of people and really cut down their travel. But for others, it's just not suitable, and we totally understand that.
Sarah, can I just jump in
Karen.
and say that the portal is not meant to be an alternative to being seen by CAMHS. What we know is that families are waiting for long periods of time for assessment and diagnosis. And what we also know is that, whilst diagnosis is really helpful for some children and young people, or for lots of children and young people, in understanding their needs, support doesn't need to wait for that diagnosis. There are common issues that families can be supported to kind of work with their child on whilst they're waiting to be seen. Thinking about things like sleep, too much energy, a kind of lack of concentration, things that cause real stress in families do not need to wait until diagnosis. We can start to be working on these things now. And this portal aims to kind of have content that guides families through these really difficult situations in actually evidence-based ways. So almost as if they were sitting in front of a local clinician talking about sleep or talking about concentration and having someone guide it through. That's the purpose while we wait.
Because to add to that, Karen, sitting on a waiting list is not a therapeutic interaction, Sarah. We know that, and there is so much help and support and work that can be done with these families, that are waiting, that before they come to CAMHS, that might alleviate some of their daily issues that they're experiencing.
Exactly. And I think that's the benefit that we found working in partnership with yourselves and the other agencies that you've mentioned in this process, is to make it clear and have all the information in one place, that you don't need to have a diagnosis to get support from the Carer Centre or from the ADHD support group or from parent to parent or any of these other services. You if you're waiting for support, if you're on CAMHS waiting list, or you've previously been diagnosed and you're not currently at CAMHS, all of our services are available regardless of that status. And so it's really getting that message out to people, which I think is really important. And also really important that we're all on the same page as well, and talking to each other, so that families are getting that consistency of support. So if families do get involved, either through a questionnaire or a focus group or a longer term bit of work, how are you going to keep people up to date with progress of this improvement work, Keren? How will they know that their feedback's been taken on board?
Yeah, so first and foremost, we're pulling together as partner organisations our social media accounts. So there'll be regular updates through the kind of key partner social media accounts and also through our social media account. There will also be a dedicated page on our Facebook page that will be launched today, that really will just keep you up to date with kind of all the improvements that are going on, how we're using the information. We might put some things out. We also might use social media as a bit of a call to action to review some of the work that we're doing and get your feedback. So that loop will continue. And also any information that we have that's not relevant for the portal will be passed to our neurodevelopmental improvement team within CAMHS. And there is a lot of work going on, as Diane rightly said, in our video around service improvement on the neurodevelopmental pathway. So all feedback and information is really important.
That's great. So all of this engagement work is being launched today. So people should be checking your social media, and I'm sure that the links are being shared in the chat, and also through the partner agency's social media. And for those of you who are working with Dundee Carer Centre, we are actively recruiting people just now for focus groups to get involved in that. So feel free to get in touch with myself or Jessie at the centre, and we can do that. So next steps, is there anything else, Diane or Keren, you'd like to highlight at this point?
I think I would just like to say again, thank you for everybody that does engage with us. And if people can't engage through social media, please let us know. There's other ways. We want to try and reach as many people as possible, but we want to know that any information that we do get that helps us shape the service and support children and young people, we want to make sure that we feed back to you what we have done with that information. We used this this method or this model when I was going to say we, that's the royal we, when Keren mostly designed our website, and it's been fantastic. It's been amazing what she's done. And, that came from consultation. So we see the power of consultation. So, we don't want to do to you. We want to be with you and co-produce with you. So, please, if there's different ways that we can communicate and that's more appropriate to yourself, please feel free to contact us to let us know that.
That's great. Keren, anything else that you would like to add?
No, absolutely not. I'm just really excited that we're getting to this point, really excited to kind of start really kind of listening and learning from families.
Absolutely.
Okay, well, thank you both very much. And all the comments, all the information will be in the chat. This episode will be available to view on our Facebook page and the Virtual Hub Gallery on our website. And we will be sharing this link with all the key partner agencies. So we should be able to share this Facebook broadcast across Tayside. Links today have been posted in the comments section, but also can be found on the Carers of Dundee website. But obviously the CAMHS Facebook page will be key for everybody to follow as well. Okay, thank you all very much for joining us, and we'll see you all again at the next Virtual Hub. Thank you. Bye-bye.
Thank you.
Bye.